atrium is the most posterior part of the heart. Left atrial enlargement, example in mitral stenosis, can lead to dysphagia due to compression of esophagus, hoarseness because of compression of the left laryngeal nerve, which is a branch of the vagus nerve, totally called the Ortner syndrome. Right ventricle is the most anterior part of the heart and most commonly injured in trauma. Left ventricle is about 2/3 and right ventricle is about 1/3 of the inferior cardiac surface or the diaphragmatic surface. Pericardium consists of three layers from outer to inner. It is fibrous pericardium, parietal pericardium and epicardium, or also called as the visceral pericardium. Pericardial space lies between the parietal pericardium and epicardium. Pericardium is innervated by the phrenic nerve. Pericarditis can cause referred pain to the neck, arms, or one or both the shoulders, often to the left. Coronary blood supply. The LAD and its branches supply anterior 2/3 of the interventricular septum, anterolaterally lateral papillary muscle and the anterior surface of the left ventricle, which is the most commonly occluded artery. The PDA supplies posterior 1/3 of the interventricular septum, posterior 2/3 of the walls of the ventricle and the posterior medial papillary muscle. RCA supplies the AV node and SA node. Infarct may cause nodal dysfunction, that is, there can be bradycardia or heart block. Right marginal artery supplies the right ventricle, RV. So coming to the dominance, the right dominant circulation is the most common. PDA arises from the RCA. Left dominant circulation is equal to PDA, means the PDA arises from left circumflex artery. Whereas codominant circulation means the PDA arises from both left circumflex and the RCA, or the right coronary artery. So the coronary blood flow to the left ventricle and interventricular septum peaks in early diastole. Coronary sinus runs in the left AV groove and drains into the right atrium. That is the end of cardiac anatomy.